Dr. Almeida, welcome to Neurosurgery Tales. It's always a pleasure to see you. So, can you tell us more about how neurosurgery started for you? Why you decided to become a neurosurgeon?
Hi, Aureliana. Very good to see you again, and always a pleasure for me as well. I'm a neurosurgeon, as you know, dedicated to skull-based tumors and brain tumors overall, and of course, passionate about microsurgical anatomy and endoscopic skull-based surgery. And currently, I'm at the Mayo Clinic here in Florida. I'm. It is interesting to me how things happen because I'm not one that was raised, dreaming about medicine or much less neurosurgery. When I decided the way for me to get into med school was a very interesting one. I was actually thinking about sports or nutrition, something related with physical exercise. I was, as a teenager, I was doing a lot of that, like martial arts, swimming, running, and etc. And then when it came the time to apply to college and then to med school, my family was going through financial hardship, and in order to get a scholarship to continue my studies, the preparatory school back in Brazil, they said, well, you should consider medical school, and we're gonna help you with that if you go into that direction. And then my family talked with me, and indeed, medicine has many different options once you get into it. And then I did that. So I applied to med school, and I was doing well in school, and I did well, and I got into med school. I was 17 years old at that time, and I got into med school thinking about sports medicine. That's what I was interested. I went to conferences of sports medicine, and I remember very well like what was a hot topic on at that time, and that's 2002, 2003. But then I got to the anatomy lab, to the anatomy, basically lectures and dissections in med school, and then I got to brain anatomy, and then I fall in love with that. Initially, before going through that experience, I was actually terrified. I was afraid that I was not going to be able to be a doctor because I was afraid of, some
Oh,
people just never get comfortable with tissue and etc. But that was not the case with me. And after that, I got into projects that we had during med school, like neurology projects, neurosurgical projects, and research, and all of that just reinforced that interest of mine. At that same time in med school, I have a good friend of mine, Lucas, that is an amazing neurosurgeon, by the way, Lucas Alverni in my hometown. We started to do research projects together, following neurosurgeons together, and then also doing night calls together, like in trauma hospitals and following people around, and so we were really passionate. I mean, we were, of course, doing all of that for free, just for the experience of it, and then I fall in love with it, and then especially so for the anatomy part. At that time, I didn't realize that I would see that some of the best in microsurgical and microsurgical anatomy are actually from Brazil, from my own country.
mm-hmm.
But so I was reading through the resources that we had, like the 2000 Rotons edition and 2002 Rotons edition, so super and infratentorial spaces. He has a dedicatory to Dr. Evandro de Oliveira, my mentor, Dr. Wen Hung Tzu, and Dr. Elder Tedeschi, all people that I train with. And Elder Evandro did residency with them, and Wen is somebody that up to today we still collaborate together. And that was amazing to me because I didn't realize that in my own country I would see the best of the best. I thought that would have to, kind of go abroad to see that, and that was not the case. So, um, anyways, that how kind of like things started, and then in med school as well. In Daniel med school, I had a chance to go to Johns Hopkins. Dr. Alfredo Quinones, Jose, who, by the way, is my current chair here at Mayo in Florida. He helped me to go and do a sub internship and do research. I was, at that time, planning and thinking that I would be doing residency in the U.S., research, and then, staying here.
Mm-hmm.
And what happened was very different from what I imagined. That didn't work out. Like I didn't have. That's 2008. The scholarship that I was going to get never really happened, and there were contingencies in the lab and etc. So it didn't work out for me. I didn't have money just to come to the U.S. out of my own. And I stayed in Brazil. I applied for a neurosurgical residency the following year.
Mm-hmm.
So not in the year that I finished it in 2009, and then I got into neurosurgical residency and exactly with the people that I admire the most, with Dr. Evandro and Dr. Elder Tedeschi. And that's at Unicamp in Campinas in São Paulo. And then I had 5 years of training with them, and I just fell in love more and more with microsurgical anatomy and the art of surgery, because the philosophy of that school is really in terms of doing the best surgery and the actually most beautiful surgery that one can do, which is what I believe. And that contaminated me to my roots. So that's what I believe. That's the core of my philosophy, and this combination just transpired into everything else that I do, like endoscopic skull-based surgery, brain tumors, skull base. I mean, you name it. So I'm a very lucky, I think, human being.
Yeah, and you trained like with Dr. Evandro de Oliveira, who is a leader in neurosurgery. Like we,
Yeah,
yeah, you have been
yeah.
very lucky. But beside that, um, what what resources you used? Because I remember when I first met you at Mayo Clinic, I was astonished by your knowledges in neurosurgery and microsurgical dissections and everything. So I was thinking maybe you can share some resources that you think may help us.
Resources, you mean in terms of books or papers or things like that to
Yeah,
learn
yeah,
anatomy?
yeah.
Oh,
How you learn?
I think there are many. I mean, nowadays we are way more blessed than we were even 20 years ago, just because in the internet we got so many resources, and many great people have come together to basically widespread that online. So additional to everything that came from Dr. Roton's laboratory, I think is valid. Absolutely anything and everything. I myself, I'm a big fan of the work done by Dr. Juan Fernandez Miranda out of Stanford. So I'm a big admirer of Juan's work. I mean, I follow that very closely. And so everything that comes out of that space is very good as well. Dr. Maria Periselda at Mayo in Rochester does a beautiful work. I do encourage everyone to take a look at that. And Maria's group, they have published some very interesting work about how to set up labs and how to do some dissections, photography, preservation of tissue. So I find that very, very nice and very interesting. And additional in terms of of course, I find that we do some good work as well. So I suggest people to check it out. And
Hmm.
uh, the work of the mentors that I mentioned, Evandro de Oliveira, Elder Tedeschi, like Evandro de Oliveira work in cerebrovascular surgery is unbelievable. And the work that Dr. Wen did and does with temporal lobe is incredible. The skull base work that Elder Tedeschi did back in the 90s and 2000s is, incredible too. And and then finally nowadays you got the resources online, like Neurosurgical Atlas that accumulates a lot of those resources, and on YouTube.
Hmm.
So I would start with that, and you're gonna be inundated by so much information going on that for sure.
um, you have been trained. You did your residency in Brazil, and then you moved for the fellowship in Canada, and then now you're a neurosurgeon at the Mayo Clinic in Jacksonville, Florida. What challenges did you face when transitioning from residency to fellowship, and then from fellowship as being an attendant? Um, was any changes in your responsibilities
Yeah, I
and
mean
how you
there is
handle
always
them?
changes in responsibilities, and that's always the case. And in one's life, I think we just get more and more responsibility that accumulates over time and transpires. Uh, but as you were saying, like after training and working with Dr. Oliveira, and here I need to be fair. I mean, Dr. Oliveira was like this apex of the neurosurgical kind of like a food chain, so to say, the master of the masters, in my opinion. But I also have to be very thankful to all the other mentors that helped me in the way. So, but please, everyone that I did not mention, please, I have to be thankful, to Mateus Dal Fabro. I have to be thankful to, Enrico Ghisoni for my residency, Marcos Maldaun, Jackson Gondim, Lucas that I mentioned,
Mhm.
Mateus Neto. I mean, so many people that I wouldn't be fair. So all of those are friends and mentors on my path, and if it is up to me, I try to keep them very close, because things are just going well for me because of the people that I found on my journey, and I'm very, very thankful that I found those guys. But as I was saying, um, I was working with Dr. Evandro, and working with Evandro with Oliveira was amazing. He was, to me, never was just an amazing surgeon, but He was somebody that I was close with. He was a good friend. He was, you know, he was the one guy that I would reach out to have conversations about where my profession is going, where my life is going, which directions they're going, and we used to exchange jokes and in WhatsApp and things like that. So, and then we would have many different opinions sometimes. So it's not always flowers or so. But I'm also a strong-minded person. But he's the mentor that I needed to have, at that time. So just sharing this because he was not only an amazing neurosurgeon to me, he was also a fantastic person, a very complex person for sure, but somebody that helped me a lot to become the person that I am today. So from residency to working with Dr. Evandro in other systems, you accumulate responsibilities because as you finish residency and you finish residency, you are in the apex, you are the chief resident, as if you are like, good lord. I mean, the master of the masters, like you have that illusion for 1 year, then you finish and you're absolutely nothing again, and that's very challenging. And in my personal situation, I accumulated a bunch of jobs in that first year. So I would do a lot of calls, and I would work in hospitals in a little bit far away cities to kind of do cases like aneurysms, tumors, and things like that in the public system. And then I would do my master's at that time, and I would do a neuro-oncology course, and I would do some endoscopic cases in the university with Mateus Del Fabro to get more experience in endoscopy as well. And I would work with Evandro. So there was a lot of work in that first year. A lot of work and not a lot of financial, gains, which changed in the second year. It became better. But in the first year of auto residency, I learned one thing that it's very important to understand, like in neurosurgery, and if you want to grow and if you want to really be a good neurosurgeon, you're dealing with patients that are especially like brain tumors, and so that have a problem that none of us ever dream of having. None of us want to have that. None of us, we're all terrified with that. So our patients require a lot of attention. They're demanding patients due to their complex pathology, and we need to be available. And in residency, I had this impression that you're on call or you're not on call. And in reality, as neurosurgeons, we kind of like are always on call. That there is no such a thing as really being off. And that's true up to today. Sometimes I'm on vacation and patients, I'm in Greece and people wake me up at 3 a.m. in the middle of an island with phone calls. And I feel the responsibility of picking it up and talking with my folks. The other thing that I learned, additional to that importance of availability, was the importance of the ability, right? I mean, you get out of residency, you have a license to practice, but you're still like in the beginning, so you got to grow a lot, and that's something that you observe as you start to do your own cases.
Mhm.
And then the third thing is what here in America they always talk about ability, availability, and affability. It's this ability to communicate with people. I think that's key. If you cannot relate with your patients, with your colleagues, with colleagues of different specialities, and to communicate well and try to understand what other person is coming from, it becomes very difficult to do what we need to do, especially in a setting of a multidisciplinary practice, which is what we do nowadays. So with all that happening at the same time, I worked in São Paulo, in Brazil, in that group, and with other groups from 2015 all the way to the end of 2017.
Mhm.
At that time, the end of 2017, I mean, the middle, end of 2016 actually, to early 2017. Uh, uh, Dr. Evandro and I, we had like differences in terms of kind of like I wanted to grow more in endoscopic skull base, and he was supportive of that. But of course, it would be difficult to work in that very heavy microsurgical practice, and I needed to have more training needed because I was doing pituitaries, but I wanted also to do more endoscopic skull base. So he helped me to get my fellowship at University of Toronto. He helped me to connect with Dr. Fred Gentili, so I went to do an observership in Toronto back in 2016. I spent a month with Dr. Gentili. I saw how busy, that program was, and I fell in love with it. So I applied for the fellowship. I got the acceptance by the end of 16, and then I went to Toronto in the following year. At the same time, 2016, I was in New York as well for 4 months with Dr. Ted Schwartz at Weill Cornell. That was also an amazing experience for me, but it was not clinical. It was Like, I was following, observing, and doing research, anatomy research in the lab, but was not clinical. And I wanted to have that clinical expertise as
Hmm.
well. So after that time, I went in 2017 to Toronto, initially for 1 year, with that specific goal. And then everything changed again. Like, you go back kind of to in training, right? I mean, as a fellow, you're in training, so you have once again to you have to almost like you have to be under someone and to follow the chain of commanders again. That worked well. The challenge was another country, of course, another language, another system, but thankfully I think adapted well. And then once again was an amazing experience. Very, very busy. University of Toronto, the Toronto Western Hospital, great people. Dr. Gentili was my point of contact, but Dr. Zadi, who is the current chair and head of the department, amazing neurosurgeon. She is extremely talented surgically, but also very busy academically. A great leader and really pushing the field forward. And I think certainly so an example for all women interested in neurosurgery. Dr. Mark Bernstein, Paul Konkan, Ivan Radovanovic, and I mean, just a great group of people. Everywhere you look there, they have gigantics in neurosurgery. So I had the opportunity and the happiness of being exposed to that. And then took over call, resident call again, and do cases. And you fluctuate from like a resident level to a super consultant level very quickly. But I had a chance to be in Canada, which is a beautiful country, great people, and learned a lot. I had a lot of new
Hmm.
contacts and grew. So what was supposed to be 1 year actually became 2 years. In fact, Dr. Evandro went to Toronto in 2018 to a course that we had together called the Luhi course. That I at that time I was helping Ivan Radovanovic to run that course, and then I had Evandro and Ivan and Fred all together, people that are my mentors, and especially putting Evandro and Fred together was very special to me because Fred also came to be not only a great surgical master to me, but a source of a personal influence to me. Like he was very important as well, but a different personality compared to Evandro. Fred was, a person that would become very close socially. So we would go out and have proseccos and have wine and talk about life and just connect. And he would share the love for Canada and Toronto and contaminate us with all of that. And he was I would say the apex of human being to me. And I literally tried to translate with the fellows that I have now what I had with him, which was, like amazing, amazing master. And that gave me, my wife had an opportunity, a professional opportunity to migrate to Canada as well. That was positive for her, and she did that. And at the same time, I had a chance to go to Cleveland Clinic. So I went to the Cleveland Clinic, and things were going well. I was getting kind of some, actually job opportunities in the United States. And then guess what? Another crisis happened, which is COVID. And then everything stops, and I don't know what to do.
Yeah.
Nobody knew what to do at that time, not only myself. And then different things are happening. I briefly returned to Canada for 6 months, working with Ivan Radovanovic then in 2021. And then I'm strongly considering going back to Brazil because at that time, if you remember, like nobody really knew what was happening. And then I talked with Alfredo
Hmm.
Quinones
Yeah.
about. I just wanted to have his perspective, and he shares well. If you want to consider, I have something here to start on a very junior faculty level, but it's something that you can consider since you're exploring. And that was it. And then I talked with my wife. That was the conversation I
Hmm.
had about the position here. And then I came, and I've been here since then. And then I've been, kind of going up the ranks, so to say. And that this opportunity here, I've been here since November 21, has allowed me to grow a lot. I mean, now I think that has been a big
Hmm.
kind of like window to share, not a window, like a big channel to share the work that I have been working to achieve in the OR and outside of the OR. So now people, can see the surgeries that I do and that I can do in the philosophy that I believe. So I'm very thankful for this opportunity here, and also outside of the OR to have a chance to help to coordinate a lab in Skull Base and to have trainees working with me it is absolutely wonderful. So
Hmm.
it's something that motivates me a lot. So, but there are challenges, of course. I mean, once again, being on call at all times, taking care of people of many different backgrounds. I came to Florida and I want to learn Spanish because there are tons of Latin American patients and I speak Spanish now, so that's awesome too. And then to have people working kind of like under you, like the fellows like in the residence, it's very nice because I particularly get very happy to see the growth of each and every one of them. And I'm very social, so we do gatherings, we go to the beach, we go to restaurants, we enjoy, and they literally make me very very happy. So it's just fantastic. A lot of responsibility, but it's a very very pleasant, fulfilling experience.
That's great. It feels like you're in the right place.
Yeah,
Like
I mean,
this is your
it's kind of
place right
like
now.
it's life, right? I mean, my path is one that has shown me that we need to enjoy the moment. We really never know. Like, in all transparency, at certain point in my life, I thought I was going to be in Canada, kind of like for the rest of my life. And when I was back to Brazil in
Hmm.
2015, after my research experience that I had in Baltimore, which by the way is how I met my wife, was when I was doing research in 2014. She's a Brazilian, woman that we met in the United States out of coincidence. Basically, I thought that I was just going to be in Brazil forever as well. So I came to accept that we can only
Hmm.
control the things that we can control, and when we do what we do, it's very difficult to control and to say. But right now, yes, right now I'm here, and I'm very happy to be here, and I'll be here until I have to be here, and then things will move on.
Given your experiences, you have multiple experiences. You work with the best people in neurosurgery. What advice would you give to your younger
Maybe
self?
enjoy the ride a little bit. Don't be too anxious about it. But I don't even know if I would give that advice because we, to some degree, my anxiety is the thing that has allowed me to get where I am. At the same time, anxiety is something that you have to learn to control at some degree. It's impossible to fully control it, but you gotta control that. So maybe that would be the advice, kind of try to try to control your anxiety. I'm a very anxious person that
Hmm.
gives me a lot of production, productivity. I was on vacation last week, kind of like hiking in Utah and Arizona, and I came back, did surgery Monday, surgery
Hmm.
Tuesday, flew to give talks in another university yesterday for 24 hours. Flew back. I'm here. I came directly from the airport. I'm in the hospital right now. I'm having this meeting with you, and I'm gonna have meetings this whole afternoon. Review the work in the lab, and then tomorrow morning, first thing, I'm flying to Chicago and doing all. So that allows me to do that, and I'm happy and very happy to do so. But it's very
Hmm.
important to understand that things will come on the time that things have to come, and that's difficult to accept, but it's something that I'm working on. And this I learned from Dr. Gentili, the concept of mindfulness, and it's something that I try to practice, but it's something that is very important. So this is the lesson that the first time I learned from Dr. Gentili back in 2017. He was receiving an award at the North American Skull-Based Society, and his last slide was about mindfulness, such a thing that I had never heard about, which is kind of like meditation, living in the moment, basically. And through
Hmm.
him and observing his day-to-day life, I came to understand the importance of that. And for those that don't know, Dr. Oliveira passed away with a terrible disease, lateral sclerosis, at the age of 75, about 3 years
Hmm.
ago. No? And Dr. Gentili passed away 2 years ago with a glioblastoma himself. And if there is one thing that I remember very well that his wife would share, Gina would share, is that oftentimes she would ask him and people would ask him, he was a gentleman, the gentleman of the gentleman, and care for so many people. And then, like, why is somebody like him going through this? But what he would say is something very interesting. Is that why not me? And that's the reality of it. Things like that can happen to any of us. So um, in a nutshell, I mean, it's kind of like I think it's a lesson that I understood the importance of it. I'm not definitely not a master of mindfulness or meditation or any of that, but I try to think of him and to remember him, such as I think of Evandro when I think about surgery and trying to achieve master levels in other aspects of neurosurgery.
And besides mindfulness, how do you balance your work life and personal life to
Mm,
maintain mental health
yeah,
and in all these
yeah,
situations, that
yeah. This whole
busy
thing with mental
schedules,
health, like
surgeries? Yeah.
especially when we're young, we don't care about it at all. We think that that's all, you know, unnecessary conversation that weak people need to talk about. I think that the new generation understands that more and more that that's not exactly the case. That we all go through ups and downs, and that's the human nature. It's not because somebody is stronger or weaker that it's important to care about mental health. It is certainly so as important as taking care of your body as brushing your teeth or going to a walk or swimming or doing whatever physical exercise you like to do. In my own opinion, as I was saying, like now at age of 38, I clearly see that I was born as an anxious person that have allowed me to get at med school at 17 years old and to be highly productive, to have achieved all the rankings and gone to all those fancy places and that I've been. But in reality, it has a toll, it charges a price on that, and then you need to realize the importance of mental health. Many times, whenever I was feeling too anxious or stressed, I clearly could realize that I was just focusing in one aspect of my life that was work. You know, and if we don't try to control that, we're gonna do that.
Hmm.
It's our nature. And I'm passionate for my work. I'm passionate for neurosurgery, but like anything in life, there are good and bad. There is good and bad in what we do in neurosurgery. I mean, I hate politics, but it needs you need politics on this. I'm a strong-minded person, but you need to
Hmm.
control, your tongue, as Evandro would say, and you need to balance your speech. But I think that therefore I came to understand that you need to be a passionate neurosurgeon and work a lot to do what we do, but you also need to realize the importance and the value of the other aspects of life. So the importance of your family, very, very, very important. I do suggest that, and if for any reason anybody doesn't have a classic family, so to say, with parents, sisters, wife, husband, whatever, have friends that can become your
Hmm.
family. I think it's very, very important. Physical activity to some degree, even if it is walking, it's very important. And the importance to have are activities that you kind of like love very much that are not neurosurgically related. If that's reading a book or being movie aficionate or playing instruments or I don't know, running up and down, but you need to be able to do something that takes your mind a little bit because not all the time neurosurgery will be good to you. Sometimes your patients will do poorly. Sometimes the politics will affect you. And if the other aspects of your life are strong and solid, that will compensate a little bit the neurosurgical aspect of it. And we're using neurosurgery as an example, but that is true for anything else that you focus on life. So there is a very nice book by Nassim Taleb, um, Anti-Fragile, that he talks about those aspects. And I remember about that book, a neurosurgeon from Toronto that had, gave me the suggestion about this book, and I do advise people to look at life on those different aspects. So for me, when I came to Jacksonville, like the beach and to reconnect with the beach and the water, the ocean, is something that helps me quite a lot. Every time that I'm stressed out, I run and I go to the beach in crazy hours, like before starting my surgical day or in the end of my surgical day. My car is full of sand because I keep towels and everything. But that's me. I mean, that's how I relax. And the beach has saved me more than once. But more importantly, so the friends. I mean, the fellows
Hmm.
that I'm telling you about, I call them fellows because it's a name that somebody once gave to them, but they're actually my friends. They're people that may be a few years younger than me and that will very soon be uh, in the position that I am, or even much better than I am. And so they're my friends, in the end of the day. And then we go and we have dinners together, or we go doing some karaoke together. And I got a karaoke machine as my Christmas gift last year, and we have a great time. So the only problem, by the way, of having fellows is that they come and go. I feel like I don't have kids of my own right now, but I feel like if they were
Oh,
kids, to some sense that they come, and then they when they have to go, it's kind of like, oh, this person left, and what we're gonna do? I just lost like my Italian friend David, who went back to Italy, and then I said one of you guys gonna have to have an Italian accent now because I miss my friend. So anyways, it's that's what keeps me very motivated. I mean, it's this pleasure in the human interaction.
in you mentioned that
Hmm.
you're friend with the fellows and you're hosting them. I mean, in the uh, lab at the Mayo Clinic. Um, what is your approach in mentoring them? Do you have a strategy, or what's
That's a very good
dynamic in
question.
the lab?
Like I didn't know if I was going to be able to mentor. I mean, not only them, but not anybody, because actually it's not that infrequent that there's going to be people coming that will be here for, I don't know, a few weeks, or people that will come very quickly, and they will have like work that I consider to be kind of like much better than the work that I did. And initially I was kind of, man, I mean, I
Hmm.
don't know how I can help this person or that person, but I think that we can always help each other, and I think we always have things to learn from one another. So I go from that principle, the principle that I definitely don't know everything, and I definitely can learn as much as the other person can learn if we're open about that. So that's the guiding principle. The other one is trying to get to know what the other person is looking for, and what is the objective that they're looking, and then being very open and honest about what we can do. So what I can do to help anybody that comes here is honestly to provide my time, which I will be happy to provide
Hmm.
as much as I can. The guidance in terms of, okay, this is the instrumentation, this is the equipment, this is the tissue that we have available, and I would suggest X, Y, and Z, and I foresee that we can do this project. But I usually say, well, but don't be limited by this that I'm telling you. Try to also work on your own philosophy. Um, so that's the second principle. And then I also clarified that guidance is all I can provide. I mean, the work is really, you. I mean, the work is going to be as good as how much dedication, effort, how much
Hmm.
feedback you can receive and apply back. Uh, and I think that the third principle will really be the understanding that in a lab, like in a surgical lab, I see, and I learned that from Evandro, that learned that working with the whole Rotonian school is a surgical dissection and anatomy that will require a second step, which is mastery in photography, and then a third step nowadays, which is photo editing,
Hmm.
and then all the steps that come in the way, like 3D photography, photogrammetry, and all that technology that we have nowadays. So you not only need to do beautiful dissection, you need to capture that very well, and then you need to be able to read between the lines or between the
Hmm.
images to understand how you can translate that into surgery. Because what I share with the group here, the philosophy that I learned and the philosophy that I believe is that we're here not to do anatomy. I mean, anatomy is beautiful, but we are surgeons. So
Hmm.
we're here to understand how we can read that anatomy and translate that into surgery. Because once again, anatomy is beautiful, but if you're not doing surgery, that's not going to be, in my opinion, as effective as it can be. So that's the one point, and that's, I think, the beauty of what we have here. We're doing a lot of anatomy, but we're doing a lot of surgery, and the fellows get to also see those surgeries and to put they just really to put side by side and to go lab to R and OR to the lab at all times. And to me, that's
Hmm.
spectacular. I cannot imagine like a best setting to really kind of exponentially grow your surgical abilities.
And how do you evaluate the educational strategies all these strategies that you have in the anatomy
I
lab
think
when you teach
when we're
your
teaching
fellow?
anybody, I mean, either if that's a research fellow in the lab or a resident working with us in the OR, it's always the same way. I mean,
Mm-hmm.
I like to look at the technical aspect, and I like to look at the humane or psychological aspect of things. So you see how people mature on both ways. So in the lab, crystal clear, it's like the
Mm-hmm.
attention to detail and the quality of the photography and the quality of the dissection that they demonstrate. And I have a few examples of people that started kind of like they were able to do the surgery like a Teriano approach, but the pictures they're really not that good, and the quality was really not that good, but it was a Teriano approach. So that's the difference of what we do here. We're not just looking
Mm-hmm.
or aiming to do an approach, so to say, but we're looking to do really the best approach that can be done within that specific region. And that's what the philosophy that I think that they incorporate by the end of the time that they spend here with us in the lab. And that is translated by the photography work. And I have meetings every week with them, every Friday usually, where we review everyone's work and we have a talk by one of them. And the other aspect is this, because I think that we all, I mean, they all, and I do the same, should have this material and be able to translate that into education to other people. So we become multipliers. So we become educators, not only surgeons. And then it's important to be able
Oh
to
yeah.
get that material and to present that material properly. So I also give them a little bit
Mm-hmm.
of a hard time about how you can present that and how you can incorporate that into surgery. But that's very important because that also will be beneficial to them as they go and start their careers, because the material that they have by the fact that they spend time here will be quite unique to continue to grow and to move forward. And in the clinical setting is the same thing. I mean, it's a little bit different because it's about seeing how a resident progresses and get more comfortable with specific approaches and microsurgery and so on and so forth, but also how they communicate with the multidisciplinary team, how they communicate with families and patients, and how they can be proactive into solving problems. Uh, as we all know, like a surgeon can not only be a technician. We need to be more than that to be able to be
Yeah,
right for our patients.
that's absolutely true. Um, you mentioned taking pictures of dissection, and there is, of course, some nuances.
Well, I
Can you
mean,
please
I think
elaborate on that?
for everybody there is a different style. It's photography here that we were talking about. So I mean, as I
Mm-hmm.
said, like step number one is a master dissection. Step number two is a master photography, and step number three is a master editing to kind of fix whatever light and detail. But it all depends on
Mm-hmm.
what exactly you are photo shooting. So if you're doing a work in terms of bony work, there are details. If you're doing microsurgical work, like looking at the anatomy of the carotid system through a microscope, there are details. And if you're doing endoscopic work, there are other details. The key details are always the same. The importance of the dissection is number one is key. Don't think that you can use Photoshop for everything in life, because it doesn't work that well, in my opinion, in neurosurgery. And the photo equipment that you have will be key. So uh, you need to have fun. So I use my own money to kind of buy the photography equipment, and I have more. I have a colleague that brought a bunch of cameras,
Mm-hmm.
and he is here with us right now uh, to take micro and macro photos. So it depends on the distance that you're going to be working. The light is extremely important. You cannot have
Mm-hmm.
shadows in different aspects of the photo. The focal distance and the camera aperture will change, and you need to kind of basically read in between that. And also the 3D photography, that is a technique basically that you move a little bit of the angle and you can take the shooting. Uh, in endoscopic, it's the same details, so it's a lot of things that basically on focal distance. Basically, the endoscope, as we all know, is just a camera at the tip of that tube, which is the endoscope. So once again, focal
Mm-hmm.
distance, lightning, and contrast, and the colors, in my opinion. So I always, in most of the time, I think that the human eye finds more interesting the mix of colors like yellow, red, and blue, and those mix of colors are nice. But I don't know if you're taking 3D photos, the black
Mm-hmm.
and the black towels around, they tend to do a better 3D perspective. Just to mention an example. And I'm sorry, in terms of additional photography techniques, the photogrammetry that you can use, especially for cell phone and editing and so on and so forth nowadays, it requires some investment as well to buy the right equipment, because it's basically nothing more but a technique that you take a multitude of shots in different angles, ideally keeping the same focal distance. So you
Hmm.
basically just move the angle and the horizontality of that photography. But this is just some examples. I mean, you can experiment, and I do suggest to experiment, but focus and light, they will always be important. Everything else you can be artistic about, but focus and light, it's key.
That, that's a science. Like you have to learn how to take pictures. That's, um, I don't know.
It
For me
is. It is.
personally, it's so
It's not like
complicated.
something that you learn very quickly.
Yeah.
I actually learn every day from the fellows as well, because they're there and they're learning what other people did as well. I mean, I have my own style. I took photos like with
Hmm.
everything that you can imagine, like from my iPhone to microscopes to endoscopes to cameras and so on and so forth. So every day there is a sort of like new technology, and we learn. I mean, if you study the work of others, you they use this thing. I'm gonna try this and I'm gonna try
Hmm.
that, and I'm learning every day. So it's a nice hobby. It's a nice hobby to have photography. And I was talking with Dr. Wen Hun Su,
Yeah.
master neurosurgeon, master anatomist, and master in photography. So he came here, he was with us for one of the sessions, and he was giving us so many incredible recommendations about photo shooting that I feel that I need to do a fellowship within in photography now as well, not only neurosurgery. So
Yeah.
it's excellent. It's one more thing that you have to be passionate about.
And uh, after doing all those dissection in the lab, how do you translate the knowledge that you have? Like, how to i- individualize anatomy to each patient, specifically to the problem that the patient is going through?
Hmm.
Because dissections are different and the
Yeah,
patient is different. They
that's
have
absolutely
different
true. So
pathologies.
I think it's the understanding that in the lab, I mean, with the tissues, like with the human tissue, we are navigating through quote
Hmm.
unquote the normal anatomy of the brain, and the normal anatomy of the brain will
Yeah.
function as a roadmap to the pathology that you're tackling. So that understanding is key. If you don't understand the normal anatomy, you're not going to understand abnormal anatomy. That's why in med school we usually study first physiology, anatomy, embryology, histology, and after
Hmm.
that we study pathology, right, or anatomical pathology. Uh, so that's the first concept, and I think
Yeah.
the second concept is not only the anatomy component of it, but also the when you go to the lab and you practice, for example, arachnoidal dissection, when you practice the amount of retraction that you can expose to the brain or to the vessels or to the veins, that gives you an understanding of how fragile the intracranial spaces and how much pressure you can exert on the brain or the vessels again, and that gives you a jump into confidence and a jump into knowledge of the surgery that is quite significant, which takes time if not going into the lab. And more important, like the lab gives you this 3D view, so what it lies beyond that you're not gonna have unless if you do that. You're going to be way more conservative sometimes, and you're going to be maybe slower sometimes due to maybe a lack of knowledge in terms of anatomy. And more importantly, so that knowledge of anatomy can facilitate the understanding of how to use different approaches. It always facilitates on our understanding how to use different approaches to reach our surgical goal. So, in my point of view, those components are how we can get that impact in our surgery. But more importantly is sometimes we go and we do a surgery, and then we see the result is kind of, I was limited here. I didn't remove that part and I could have removed that part. What happened? What did I miss? How can I do better the next time? And in my opinion, that's exactly how that experience from going back from the OR to the lab that can give you that perspective. And it is, in my opinion, that we also need to be open-minded to go back and be humble and say, okay, I didn't do this because there was some lack in my knowledge of anatomy in that aspect, and not just consider that surgery cannot just
Hmm.
do that. Sometimes it's a personal factor. Surgery is not like a medication that you just give and see what happens. It there are no two surgeons that would do exactly the same surgery. It's virtually not possible, in my point of view. So basically, those are some of the concepts, but it's also very important to understand that it's a very subjective experience. I don't know how to explain, but for everybody that goes and experience, you go
Hmm.
into residency, then you finish, and you do your cases, and then you go to a lab, and then after that, you go back to your practice. There is a big jump in knowledge that I don't know exactly how to translate why or how that happens, but that happens. And that's why I do encourage everybody to also have that experience in parallel to your surgical practice. So, Evandro used to say that he didn't go right after residency. He was in practice for, I don't know, 10 years. Then he got into the lab, and then he returned, and then he became the master that he was and that he is, in my opinion.
Um, Now that you witness firsthand um, neurosurgery in different countries and different culture, what do you think should be the primary goal
Well, I think the
for
first
global
goal is
neurosurgery?
education. I mean, and education will always be key. I mean, I think
Hmm.
that many of the problems in our planet would be solved if we had higher quality, higher degree of education. Not only a title whatsoever, but really quality education in oftentimes of the most basic levels. So, in aspects, talking about global neurosurgery, I think that's the first aspect. So, to provide education and guidance, and then of course equipment for populations that really need that. And I see the work of many of my friends, people that I met when I
Hmm.
was in Toronto, like uh, Claire Karakezi, that is a neurosurgeon from Rwanda, doing an amazing work, in my opinion, in Kigali. When she moved back there, she was the first neurosurgeon in Rwanda, in Kigali. I'm almost sure that they didn't have a residency at that time, and I understand that now there is a training program there. They have much better equipment now. 5 years later, they have, a fantastic training facility that is open there now, which is IRCAD Africa. And of course, I mean, it's the work of Claire and many other surgeons there, and of course, local support of the government and the structures. But things can improve, and things we got to believe on that, that we can do better. Uh, but I think that
Hmm.
what we can do, like from this part of the planet. So I'm in North America right now, but I'm from Brazil. I believe that is the support for education at first, because if people don't know, they don't know. So I think we have that objective, and then to work
Hmm.
to how can we provide it, the most important equipment in terms of impact and outcome. And when we think about that, a lot of it is still surgery. A lot of it is still surgical equipment. Like in terms of neurosurgical diseases, we're talking about trauma, we're talking about infection, we're talking about tumors, and of course, the spinal diseases,
Hmm.
pediatric diseases, and vascular diseases. But the most common problems, they can be better tackled, and if we start with the basics, I think we have all the ability to for the growth, but it requires a coordinated effort. So from my end, I think that what I've been trying to collaborate is really in education, but I know that's one of the steps. I think the structure, development of graduating centers and training centers, and I think the retention of talent as well, so that people can continue their work and be faithful in their work where they are. Um, it's very important.
Um, what is the most profound question you ask yourself as a
I
neurosurgeon
think
during your
that
career?
to me, it's kind of like, I think that I was initially when I was younger. It's kind of like, what's the goal? It's kind of like what I'm aiming to achieve. To me, that's
Hmm.
that's clear. I mean, I don't know when that gets clear or how long did it take. I don't know. For me, took longer or not. But to me, when I was in residency, people used to say, well, you're going to finish and you're going to be doing spine and you're going to be doing calls and you're going to be paying your bills and life will go on, and then you're going to live and you're going to die and that's it. I mean, I don't like that idea. I never liked that. I'm rightfully or wrongfully, I'm very passionate and almost romantic to what I do, and I've always had this passion for
Mm-hmm.
microsurgery and then endoscopic skull-based surgery in the brain tumors. So to me, was to find that's what I want to do. That's the reason why I do what I do is for this. It's not money is not the number one goal. Of course, I do like money. I think everybody does. But the number one, yeah, I mean, there is nothing wrong
Yeah.
about that. But that shouldn't be necessarily the number one
Yeah,
goal.
absolutely.
That should be the consequence. So to me, that's
Mm-hmm.
clear. I've always followed that, and I have said no to tempting opportunities that would deviate me from that path. So to me, that was the first question. What's the goal? And the goal for me is clear: is to continue to work and to study and to devote myself in the pursuit of mastering in my field, which is brain tumor and skull base. And then I'm having fun with the water that runs in the river, which is education as well and research. So I'm having a lot of fun with that component too. And over time now, that that question is answered. It's kind of like the daily question is, am I on the right path? And it's a not an easy question because sometimes
Mm-hmm.
we got in a position and we got in whatever status we are, and you get comfortable. And it's nice to be comfortable, but also you gotta always reflect if you're not too comfortable. um, and then sometimes you need to
Mm-hmm.
make changes, and you need to be very open-minded for changes, which to me is a very very difficult task because I don't like change very much. I'm very obsessive compulsive in nature as well. So actually I don't like change at all, but I understand the importance of change. So sometimes things are, yeah, they're going well, they're going well, but they're stagnant. Sometimes you need to do changes, and
Mm-hmm.
you cannot be afraid of doing that, but you need to see if the path you're taking, even if you're changing your path, if that change will also likely result in growth towards your goal. So I think that's to me is the daily question. Yeah,
Changes are absolutely uncomfortable.
yeah,
Yeah,
yeah.
it's
But I
easy
don't
to
believe
stay
like in
in
things
the
like
same
people
place
that
you
would
are.
say, yeah,
Um,
am I happy? Is my decision making me happy? Or something? I mean, what is this thing of being happy all the time? It's kind of like I honestly don't believe in that. I mean, I
oh
think
yeah.
forget about it, wake up. That's a dream that doesn't
Mm-hmm.
exist. It's kind of like to be. There is only happiness if there is sadness. There is day if there is night. There is nothing such a thing
Yeah.
as that kind of like, I don't know, world peace dream of a top
Mm-hmm.
model type of speech. It's kind of like that's not life. So I think that is understanding that you have a goal, and that goal has demands, requests, and consequences, and then you need to balance if that's what you want. End of the story.
Yeah. I think we should stop the propaganda of being continually happy no matter what, because this is not helpful, and it uh, it's not possible. It's not.
Yeah,
We're
because there
not
is no
living in a
perfect
perfect
life.
life,
Nobody
so
has a perfect
it's
life. Even the people that we think that they have a perfect life, they do not
yeah,
have a perfect life. But and nowadays, it's very easy for a lot of people to
yeah.
imagine that there is people that have a perfect life. Um, it's a very interesting controversy and a very philosophical topic that we could talk for weeks, on the road, because nowadays there is a lot of people. There
Hmm.
is this component that there is a lot of people that share this idea of perfect life, but then there is more and more people being open about talking about
Hmm.
problems. But sometimes also that same people that talk about problems just talk about problems, and the people that have like a perfect life just talk about perfect life, and then I see the confusion. I think it's very important to have a guidance, whatever that guidance comes from, but to have a
Hmm.
guidance, because if everybody as human beings, we need to have a little bit of guidance, because we can get lost in the way. To me,
Hmm.
my family, friends, the profession that I chose or that chose me is the balance that I have and the guidance that I have. But well, as I said, philosophical conversation, but important one to have. Yeah,
We can have part
absolutely.
two
I
for
mean,
this.
I'm very keen
Um,
on talking about that. I think we need to talk more about it, because we risk
mhm,
sometimes in our time and age to be very superficial for being afraid to engage in discussion and in what is called controversies. I think that hurts our society, and I think that's actually
yeah.
very, very bad. But I see that every topic can become a very sensitive topic, and I know there is a rationale for that. But the day that we stop having conversations is the day
Hmm.
that we stop growing and we stop learning.
Yeah. In your opinion, what is the biggest challenges currently facing neurosurgeons and how they can be addressed?
Well, I think it depends a lot in where you are, uh, geographically speaking.
Hmm.
Like, of course, I'm from Brazil. I have many friends working there. I have close contacts with my friends from Brazil. And in Brazil, there is the problem with the profession in terms of different regulations, the market, the market system, and the shares in the system, the public health system are going into more and more financial challenges and equipment challenges and all of that. There is the problem of additional kind of like the medical legal aspect of it is also growing there, as far as I know. So there is all of that, and here in the U.S. Kind of like similar to some degree in terms of the pressure of the market, the what was previously like 20 years ago more common to have kind of private groups. Now most people, if not everybody, is a hired physician, so it's an employee of a big health system, or you work, or some people still working in a university
Hmm.
level, but uh, if you are employed by a system, there is the pressure of the big, health system, which in the U.S. functions as an enterprise or a company. So there is that financial pressure that is challenging sometimes, that can be challenging sometimes. And in a university setting, there is the pressure not only of production, but also the pressure for academic output, and then the pressure of the patients, and there is this whole balance that to me is difficult to reach as well. In other countries, as we all know, like if we go to more limited resources countries, I think the problem is the same: access to care, and access to proper training, and access to instrumentation to take care of patients properly. But I think that one needs to understand where the root of the problem is arising from, and to be able to communicate to try to solve those
Hmm.
problems. The big things that people talk about, like medical legal problems, they're here. So I don't think it's a future problem. I think it will continue to exist. The whole thing of AI, robotics, and all of that, I think from all the problems that we have, that's still a little bit far away. I think that there may be a balance on that,
Hmm.
but I think we have to be
Yeah.
careful not to jeopardize the art of medicine in what we do. So the component of art in surgery, I think there are still a few people trying to keep that. I like to believe we are one of them, and the spirit of really like focusing on patients, and focusing on what really is the best for each patient. Which there is so much pressure from all the different angles that I find not difficult to for anyone to be sometimes lost in the way. So it is very important to keep in mind, we're doing this for the patient, to the patient uh, at all times. And
Hmm.
that needs to be a very objective dimension on what we do. Otherwise, that can be risk to end up falling in the, chain of command in terms of list of priorities. And that shouldn't be the case ever in any system. Otherwise, we're not physicians anymore. We are,
Hmm.
I don't know what we are, technicians, I don't know.
And lastly, in your experience, what has been the most effective method for improving patient recovery
Well, good
times post
surgery
surgery?
to start with. So good surgery means better, recovery. And I think that the base is always will always be important. Good surgery means a surgery that will respect the anatomy to the best of its possibilities. Will be a clean surgery with minimal blood loss in considerations, of course, case by case. Effective surgery with as minimal anesthesia time as possible, and more importantly, so well indicated procedure
Mm-hmm.
with appropriate goals of surgery. So not every tumor requires a complete resection if that would result in additional morbidity to that patient. Not every
Mm-hmm.
tumor will require surgery. Some patients we can just observe. So that's one more detail. In some cases, we don't need to do surgery because patients may need radiation, for example. So, and more importantly, so that's very individual based on the patient and very individual based on the team treating the patient. So, not the same solution will be true in two places, for example, not necessarily.
Mm-hmm.
And finally, it's the importance of the multidisciplinary team. So, none of us can do the work well alone. So, we need a team of people working with us, and every single person is
Mm-hmm.
important in that work, from, of course, the surgeons to nurses to physical therapy to intensive care doctors to neurology, endocrinology, radiation oncology, rehabilitation facilities, rehabilitation doctors, and much, much more. So if you work with a team that is talented, that believes in that philosophy, that's really key. And I have to be very thankful for the institution where I work right now because I think that's one of the key aspects of what we do here is that of course I do believe that we are that I'm a good surgeon, that the team that we work with are good surgeons too, but I don't think that our results would be as good if we didn't have such an amazing team that we work with. So that's absolutely key, teamwork,
Mm-hmm.
and of course teamwork based on a team of people that is excellent in what they do.
Thank you. Thank you so much.